Well, it happens every year at this time. There's an influx of children with asthma to the emergency room. It's called the September Spike. Here to help us understand this annual phenomenon is Dr. Mary Noseworthy, the director of the Asthma Clinic at the Alberta Children's Hospital. Good morning to you.
Hi,
Thank you so much for being here this morning.
Thanks for inviting me.
So why don't we just start right at the beginning? What, in fact, is the September Spike?
So it happens every year around the third week of September. It's when patients and people with asthma experience the most symptoms and the most exacerbations of the entire year.
Wow. And why does it happen every year at this time? Do we know?
Yes, we do. Actually, there's several factors this time of year. It's like the perfect storm. It's these kids back in school in the crowded environment, sharing drinks, sharing treats, recess. The flu season is about to start, so there's lots of viruses. And here in Calgary and around Alberta, southern Alberta, we have the smoke in the air, so there's environmental irritants that may not have been there in previous years. Right. Many reasons.
Many reasons. So all these things are happening at once, and that's what you see, this influx of people with asthma to the ER.
Definitely.
So what happens? Like, how bad is it? What's happening in their lungs that makes them go, okay, we have to go to the ER?
So they find it difficult to breathe, their lungs fill up with mucus, the smooth muscle around their bronchioles tightens up, and I've just got two little models here which
So these are the airways?
These are the airways, and on the right here is your airway without asthma.
Okay, so it's
and
pink,
it's
open.
open, the muscles are not constricting on top around the airway, and then the model on the left is your airway with asthma. It's full of mucus and inflammatory debris. The smooth muscles on top around the bronchiole are constricting. So there's two things that are happening. There's the smooth muscle constriction, which leads to shortness of breath, and the muscles, the lungs inside, the bronchioles actually fill up with more inflammation and debris.
Wow. So there's a lot going on for these kids.
There's a lot going on for these kids, yeah.
Wow. Okay, so what can we do to try to prevent this from happening? I guess we're about a week out from that third week.
From the third week, specifically the 17th to the 18th is the 24-hour period. That's the worst period of the year.
Okay.
So we just get kids back on their regular inhaled corticosteroid puffers.
Okay.
Early. So when they start school, make sure your kids are on puffers now to prevent this.
We've got some viz here of the puffers. So these are kids using their puffers, and usually there's two, right?
There's usually two. There's usually a colored puffer, which is the inhaled steroid. That's your everyday puffer. And then there's a blue puffer, which is your reliever, your beta agonist that you take if you're actively short of breath.
Okay, wonderful. So you're saying if you've taken a break from those over the summer, really now is the time to get back on that.
Now is the time. Start today. Back on your inhaled corticosteroid.
Start today. Okay.
Yes.
And is that something, too, that parents need to be aware of when it comes to the school year? Maybe having conversations with the school, with their teachers, making sure they've got medication at school?
Definitely, because lots of kids are outside for recess and lunch hour, and it has been a bit smokier here in the city. So definitely parents should be aware of that. Exercise can be a trigger. Exercise in the smoky air can be particularly difficult for these young children and young adults, and they need to be back on the puffers and have the blue puffer with them at school at all times.
At all times. What have you seen, even just in your practice with the smoke in the air? Have you seen a dramatic increase? You're saying it's a bit more challenging, but what have you seen clinically?
So what we're seeing is the patients who are coming back for the preschool asthma checkup, they're having more worsening lung functions on spirometry.
Wow.
And they're having more symptomatic complaints. Their allergies are worse. They're finding it harder to breathe. They're having more difficulty with exercise. They're more short of breath. They're coughing more at night. They're coughing with exercise, and they're wheezy.
And they're wheezy. Wow, so lots of factors for sure.
Lots of factors.
Wow, okay, and what about the cold and flu season? You briefly mentioned the cold and flu season, but it does start right about now. What should parents know?
It starts about now. Just make sure that you impress on your children, wash their hands constantly before meals, all the time really, and make sure the kids get their flu shot when it comes out now in October.
Absolutely. And it's just the idea that the cold and the flu can really be a trigger for these asthma.
Totally can be a trigger for an asthma exacerbation this time of year.
Wonderful. Okay. And you've got wonderful websites. I know I Can Control Asthma has got a wonderful website. It even has articles on September Spike. So parents can certainly go there for more information.
And it's available in 11 languages.
Oh, wonderful. That's great. Dr. Noseworthy, thank you so much.
It's
Fantastic information as always. All right.